Hello, everyone. Just 1 minute and I'll start directly. Okay, let's start. Hello, everyone. I hope all of you will be good and ready for the exam. Just 1 week for the exam. So we are revised the last chance of revision. Okay. Today we will have the 4th free lecture about revision. Still, we have another one in the next week, just before the exam. As usual, I'll make all of you mute, and at the end, we will discuss anything you want related to the revision and related to the exam. Also, in this lecture, I'll show you how to join the mock test that produced by PTech. Okay. At any time, if you have a question when we discuss the revision of today, please open your mic and ask about it. Okay, let us start. Let us start with the first question. The first question here, a patient having a 35 years old female with diabetes. Currently, she has been diagnosed with urinary tract infection. Okay, so the main indication here is urinary tract infection. Which of the following antidiabetic drug interact with co-trimoxazole? Here, the drug of choice for urinary tract infection is the combination between trimethoprim and sulfamethoxazole under the name of co-trimoxazole. So here we have many drugs like Metformin, Rosiglitazone Glipizide, and Canagliflozin. So what is the right answer? How can we solve a question like this? And which is the drug that interact with this co-trimoxazole as an antidiabetic agent? Okay, here the sulfonamide, glipizide. Sulfonamide here, the problem here is that concomitant use of sulfonamide and co-trimoxazole, also containing sulfamethoxazole, which is sulfonamide, leads to an enhanced hypoglycemic effect of sulfonylurea, resulting in the hypoglycemia or severe hypoglycemia for this patient, resulting from either inhibition of its metabolism or displacement of protein binding site by sulfonamide, and both leading to an increase of free concentration of sulfonylurea, which leads to hypoglycemia or severe hypoglycemia. So that the patient already having diabetes, we should not use sulfamethoxazole plus trimethoprim. Okay, we should not use those drugs together. The second question, apoptosis. What is this abbreviation, or what is this term? What is the meaning of this term? It is a programmed cell death. This program in our body will help to remove the dead cells. Okay, and get out from our body. The dead cells, if present or still present, they may be a source of cancer. So it is a programmed cell death, help in removal of the dead cells from our body. Another term, which is hapten. What is the hapten? Related to the immunity or immunology. Hapten is a small molecule or particle. By itself, have no effect on the immunity at all. But if it is bind with large molecule like protein, it will generate an immunological effect. It will stimulate the immune system. This is the hapten. Okay? Do you have a question? Okay. Let us see the next. Here, a calculation problem. A patient weighing 90 kilograms with normal renal function is injected with intravenous drug for 10 hours. Okay, and the desired plasma concentration is 22 milligram per deciliter. This is the desired plasma concentration to reach 22 milligram per deciliter. The T-half of the drug is 1 hour. Directly, when we have a T-half, we should calculate the K. 1 hour means that the K equal 0.693 over 1 equal 0.693 hour minus 1. 0.693 hour minus 1. And the apparent volume of distribution is 9 liters. VD equal 9 liters. What is the rate of infusion for this patient? Here, we want to calculate. Here we want to calculate the R, rate of infusion. Okay. Here we have a pharmacokinetic problem. As usual, for any pharmacokinetic problem, we need two things. We need to know the formula that we use, firstly. And the second thing, we should check the units. All units should be similar. So let us do those two things. What is the formula connecting those information together? The formula here is R equal CP, plasma concentration, multiplied by VD multiplied by the K. This is the formula. So we need to multiply all information together. But before that, we should check the units. Here, the unit of R is milligram per hour. So any weight should be by milligram. What is the weight here? The plasma concentration, weight per volume. The weight in milligrams, so it's okay. 22, we will use it directly, 22. But the volume in plasma concentration is by deciliter, while the volume in volume of distribution by liter. So we should change this 9 into deciliter to be 90 deciliter. We should not use 9, we should use 90 in order to be right answer. If you use 9 liters, it will be wrong answer. Okay. The unit of the time is hour, and here the T-half by hour, so it's okay. So directly you can use the K, which is 0.693. Okay. Directly multiply all of those information together to get the answer, which will be 1,372 milligram per hour. Okay. Any calculation or pharmacokinetic calculation problem, you should do that, knowing the formula that you will use in this calculation problem. Then check the units and make all units similar. Okay. Let us see another calculation problem. It's not calculation here, but just a question. MP is a patient of 40 years old, has recently diagnosed with major depression. The indication here is major depression. Okay, and was prescribed a medication, Fluoxetine, 20 milligram once daily, and asked you the optimal response time for his medication. What is your response? Here you should know a very important thing regarding to the antidepressant agents. The antidepressant will not give a full response before at least 4 weeks. Okay, at least 4 weeks. So it needs 6 to 8 weeks to give the full response, and the patient should know this very well. Why? Because after 1 or 2 weeks, the patient will not feel any improvement in his case. Just if he has an insomnia, it may be improved, but the other depression symptoms will not start to be improved. And in this case, if the patient does not or didn't know that this drug take a time to give an effect, he will stop it. And this will be a problem. With some drugs may lead to withdrawal symptoms. So the patient should know very well that this drug should be continued for a long time to get the maximum response and to maintain this response. Okay, do you have a question? So the answer here will be number D, from 6 to 8 weeks. Ethylene glycol typically presents antifreeze with oxides, which oxidize to a toxic metabolite. What is the toxic metabolite in this case? What is the ethylene glycol? This is the ethylene glycol. Yes. If we draw its structure, this is the ethylene glycol. Okay, ethylene glycol. So it's oxidation leading to what? Oxidation of both OH groups, which are primary alcohol. Both are primary. The final result will be acid, carboxylic acid. So it will be COOH and COOH. What is this formula? This is the formula of oxalic acid. So the final result of oxidation of ethylene glycol is oxalic acid. The next question, one of the calculation problem. No, it is not calculation, but it is asking about a dose. At which dose does dopamine function as a positive inotrope? I have a comment about the voice. Is the voice having a problem with any of you, or is it good? Yes, good. So if anyone having a problem with the voice, check your internet connection. Okay. So let's go back to this question. At which dose does dopamine function as a positive inotrope? Here we have 4 doses: 40 milligram per kg per minute, 40 microgram per kg per minute, 20 or 10 to 20 microgram per kg per minute, or 5 to 10 microgram per kg per minute. We have 3 doses of dopamine, each dose having a specific function. The low dose, the medium dose or intermediate dose, and high dose. Let us see the table for those doses. Okay. The low dose in between 2 to 5 microgram per kg per minute. What is the action of this dose? It will cause diuretic effect. It will act as a diuretic. Okay? The medium dose in between 5 to 10 milligrams. What is the action of this dose? It will act as a beta-1 agonist, so positive inotropic effect. The higher dose above 10 microgram per kg per minute, this dose is vasoconstrictor, leading to vasoconstriction. Okay, so the positive dose is a medium dose. Positive inotrope is a medium dose in between 5 to 10. Here less than 5, here more than 10. Okay, this is the dose for congestive heart failure, the intermediate dose or the medium dose of dopamine. Okay, can we use the low dose for congestive heart failure patient? Yes or no? Yes, we can use because it have a diuretic effect, so it will be good. No problem with this dose. But can we use the high dose for the congestive hypertensive patient? For sure, no. The vasoconstriction effect will be contraindicated for the patient who having congestive heart failure because it will increase the resistance toward pumping and increase the effort done by the heart. Okay, so the dose used in congestive heart failure is the intermediate dose as a positive inotropic effect. This is the normal dose, but we can use the low dose as a diuretic also. Let us see this calculation problem. If the rate of infusion of a drug is 750 milligrams every 6 hours, okay, and clearance is 8.3 liters per hour, what is the steady state concentration? As usual, we should know the information that we have. R equal 750 milligram, but every 6 hours. Okay. The total clearance equal 8.3 liters per hour. What is the steady state? Check the unit of the steady state, either milligram per liter or gram per liter according to the choices. Let us put it as milligram per liter firstly and see what we will do. What is the formula of this information? The formula collecting those information is CSS equal R over the total clearance. So just dividing the rate of infusion over the total clearance. But the second thing is the unit. Check the unit. Can we use the 750 over 8.3 directly or not? We should not do that. Why? The unit of the weight, it's okay. There is no problem. Milligram and milligram. The unit of the volume, also there is no problem. Liter and liter. But the unit of the time here 6 hours and here 1 hour. You should make them equal to each other. How? You should convert this 750 milligram per 6 hour into how many milligrams per 1 hour. So 750 per 6 hours. How many milligrams per 1 hour? Divide by 6. If you divide 750 by 6, it will be 125 milligrams per hour. So the number that you should divide by the clearance is 125 over 8.3. What is the answer? It will be 15.06. 15.06 what? This is a very important trick you should take care about. Yes. 15.06 milligram per liter. Not this answer. So take care. Be alert in the exam. This is a wrong answer, but this is the right answer. 15 milligram per liter. Okay? As you saw, very easy question, but you should be alert with the units. You should be alert with the formula. You should be alert with your calculation and take care for those types of questions. Let us see this question, which make a confusion for many of us. Hyperventilation is a condition that leads to hyperventilation. What will happen in hyperventilation? Increase in breathing rate, so that increase in exhalation of carbon dioxide. What is the result of carbon dioxide in our blood? Carbon dioxide will decrease. Okay, so after hyperventilation, carbon dioxide will decrease. This resulted in what? If carbon dioxide decrease, the pH increase. The blood converted into alkaline part. It will be more alkaline. So we will have a case of alkalosis. But this alkalosis called respiratory. Why respiratory? Because the main cause is the lung. The first cause is the lung. The lung having a hyperventilation, which leads to decrease in carbon dioxide, and this carbon dioxide leads to a rise in pH level and becomes more alkaline pH. So the right answer here is the A. Lower carbon dioxide concentration followed in rise in pH. Okay. Also, this question may be confusing for many of us. Here we have a question about what is the difference between Kussmaul ventilation and hyperventilation. Both are hyperventilation. Kussmaul ventilation, this expression means deep and fast respiration. Both are the same. Okay, but we should know here which happened firstly. The respiration affected firstly, or the respiration affected after another cause. Like what? If we have metabolic, if we have metabolic acidosis, what does this mean? Metabolic, here the reason is not related to the lung. There is another reason. Metabolic acidosis means what? An increase in carbon dioxide level. This increase in carbon dioxide level leads to what in the pH? It will decrease the pH of the blood. The body, as a compensatory mechanism, try to exhale carbon dioxide as much as possible. So what will happen for the lung? Hyperventilation. Okay, so this hyperventilation here is a secondary effect, not a primary effect. Not like this. Okay. So hyperventilation, if it is primary, it will lead to respiratory alkalosis. And if it is secondary, it is due to metabolic acidosis. Did you go to this point? Okay. Let us see the next question. Which of the following is most common metabolizing enzyme for clopidogrel? What will happen for the clopidogrel? Clopidogrel is a prodrug. Okay, it should be converted to its active metabolite by the effect of cytochrome 2C19. Which is the common drug that inhibits this enzyme? Omeprazole. Omeprazole will inhibit this enzyme so that decreasing the metabolism of clopidogrel and leading to declining its effect or decreasing its effect. Which of the following causes a decrease in renal calcium clearance? Okay, or impair calcium excretion? Let us see the choices. Hypoparathyroidism, leading to what? Hypoparathyroidism. Does this leads to decreasing calcium clearance or have an effect on calcium clearance? Or treatment with chlorothiazide. Here, decreasing renal clearance of calcium, meaning what? What is the other expression that we can call this state?
Increased reabsorption.
Increased reabsorption leading to what? Hypercalcemia. Right? So, to be clear, this question asking about which will cause hypercalcemia. Hypoparathyroidism leads to hypercalcemia? No. Treatment with chlorothiazide. Chlorothiazide, one of the thiazide diuretics, which leads to increased calcium level. So this is a right answer. Treatment with furosemide. Furosemide will decrease calcium level. So this is a wrong answer. Extracellular fluid volume expansion. There is no relation. And hypermagnesemia also will not increase calcium level. So the right answer here for this question is number B. The last question in our revision today. Verapamil metabolism should be considered while taking which drug? Okay. Verapamil, is it an inducer or inhibitor? It is inhibitor to the cytochrome 3A4. So it will cause an interaction with a substrate of cytochrome 3A4. Here, the verapamil metabolism should be considered while taking which drug? Aprepitant, irbesartan, carbamazepine, or ipratropium? The answer here will be irbesartan. Okay, the verapamil metabolism should be considered while taking the irbesartan. Here, a slide collecting some drugs having active metabolite, in which answer the question about which of the following having an active metabolite. So this table will help us to know which drug having active metabolite. Let us see some examples like amitriptyline, buspirone, codeine, desipramine. This means that those drugs are active and the metabolite of them also active one. Okay. Another drug like imipramine, isosorbat dinitrate. Okay. No, not must to be a prodrug. Some of them are prodrug, but some of them are also active drug. Like amitriptyline is an active drug. Its metabolite is nortriptyline, also an active drug. Codeine is an active, and morphine, the metabolite, is active also. Imipramine is active. Lisipramine is active. Isosorbide dinitrate is active, and okay, isosorbide mononitrate is active. In the last question about why verapamil metabolism will affect the herbizertane as an inhibitor, it will increase the level of herbizertane. We should take care about the use of them together. Okay. Both of them will affecting the heart also. So this is the drug that should be considered while taking the verapamil. Carbamazepine, both of them will affecting each other. Both of them will affecting each other, carbamazepine and verapamil. So the answer here will be herbizertane. Okay. Let me say something about the mock test that introduced by PTEC before we starting to opening the discussion. Okay. In our website, we have this mock test, which help you to mimic the real exam. This mock test having a distribution of questions like the real exam. So you can do it before the exam and mimic the real exam. Okay. It's formed of 2 papers, each of them having 100 questions. You should solve them within 2 hours, like the real exam. The distribution of the topics like the exam also. So when you solve it, you will feel that you are in real exam. And this will help you to manage your time also in the exam. The questions in this mock test different than that we discussed all over our revisions. How can you join the mock test? Okay, firstly, visit this website, our website, www.newptech.com. Then the second step is registration. If you do not register to the site, okay, then this registration will leads you to this page or this picture. You will fill the information here needed, the username, your name, first and second name, and username and email. Then after registration, log in with your account. Okay, after logging in and enter your username and password, you will go to the courses from the menu bar and choose the KAPS exam preparation courses, enroll here. Okay, then choose the mock test. Choose the mock test. After choosing it, the mock test will open, and here the adding to cart, add to cart for payment, and proceed to the payment with your information and choose the best way for payment. Then after payment, the mock test will open directly to your account. Okay. So it will open here. You can start the test from the curriculum. The curriculum here will show you the paper 1 and paper 2, and this look will be opened. Okay. When you start the test, when you start the paper 1, press on start. It will drive you to the questions, and the timer here will be decreased. Okay, you should choose the answers and press next after each question till finish the core questions, and then click on the finish the quiz. After finishing, he will ensure that are you sure to submit the quiz? Okay, then directly he will give you the result. Okay, directly he will give you the result or your response in this test. You will pass if you solve more than 50% of the questions in the right way. You can review the answers, your response, or retake the exam. You can retake the exam extra 2 times. Okay? When you make a review, you will see all questions and the right answer of each one and your response. Is it right or wrong? The right answer will be surrounded by a green box. Okay? My recommendation is to solve 2 papers after each other, starting with paper 1, then take a break for maximum 1 hour, then solve paper 2 in order to mimic the real exam. Okay? Now it's time for your question. Please, if you have any question, any concern about the exam, about the revision, about anything, please ask about it. Yes, the mock test can be attempted 3 times. You can attempt the mock test 3 times. Still, we have another revision in the coming someday, the free one. But the full revision or the full most recent recalls will be on the coming Tuesday. Just one mock test available in the website. For persons who are attend the course, the full course or the full revision, already they have the mock test in their account, so they do not need to purchase another one. Any question? Dopamine is a beta-1 agonist or beta-1 and beta-2. It is beta-1 agonist. Its pharmacological action is beta-1 agonist. But generally, for the selective agonist or antagonist, as a general speaking, when you increase the concentration for the selective agonist or antagonist, and all enzymes occupied with the all receptors occupied with the drug or the agonist, for sure you will find some effect on the other receptors. So if we have a high dose of dopamine, for sure you will find some effect on the beta-2 receptors, like beta blockers, the selective beta blockers, selective beta-1 blockers. If you have a high dose of the beta blockers, the selective one, what will happen? They will also affecting other beta receptors. Okay, all receptors will occupied, and then the other receptors will be affected. Any other question? Thank you. Thank you for your comment. Thank you for all of you. I hope you will have a good exam and all of you will pass your exam. Okay. At any time, if you have a question, send it in our groups to discuss and sharing the experience with each other. Thank you so much for your attendance today, and I hope to see you in the coming week just before the exam. Goodbye.
Thank you.
Thank you.